And we're going to talk a lot about health insurance tonight. And those two have been known a time or two to complement each other, right? Healthcare, health insurance. You have to have one to have the other. That's just part of the Great Deception. So let's go to the beginning. Let's talk about where health insurance came from. Let's talk about how this country got in the predicament we are right now, that the health cartel is truly in control. And I'm going to surprise you by telling you how much and how happy you are that that's the case. Because many people believe in their heart of hearts that everything is on the up and up, and that without the health cartels, you couldn't get the care that you truly need. All, once again, part of the Great Deception. It's in the very early 70s, something came along that changed the entire health care industry. And that was the advent of the HMO, or the Health Maintenance Organization. Why did it change everything? Because all of a sudden, now you had an organization whose primary goal was to control its members, was to make sure that those members' health was maintained. And more importantly than anything, the employers themselves felt like they were now getting a good deal. What they were convinced of is that by paying less, I have happier employees and I have healthier employees. Think about it. You're going to manage their health and make sure that these guys come to work more often. What a great concept. What really started getting the HMOs in trouble, though, was the smaller networks. Because it was a smaller network, people started to kind of revolt a little bit and find out I can't go to my same doctor. And all of a sudden, because times were going a little bit better, people said, I got a little extra money. Can I just go to the doctor I want to? What would that take? Well, you'd have to have a PPO. So how did that affect the employers? Well, the employers are now paying a higher amount. And they're paying anywhere from $12 to $20 per month for each employee and family member that has to have access to that PPO. Okay, but that's not a bad deal if I'm getting big discounts, right? The cost baseline that you need to understand is all about Medicare. Medicare's cost, what they allow for any service, is the baseline across the country for hospitals and doctors. Well, that means if I'm getting a discount on a PPO, then I must be paying less than that. No, you are not. In fact, the average hospital increases the price based on Medicare baseline. They increase the price 550%. And then, being a member of the PPO, they cut that by about half. So your discount gives you access to something 2.5 to 3 times more than someone on Medicare. Well, how can that be? How can hospitals just allow that? Here's the baseline. Why would they allow these folks, these insurance companies, and these PPO networks, why would they allow them to charge more than this baseline? Well, an average hospital can make a profit. If they're well run, an average hospital makes a profit based on that baseline. Well, if they're making a profit there, what do you think they're making up here? What about the insurance company? Is it in their benefit to pay less? Well, you would think so. But most of the laws governing health insurance cap how much they can make. They can only make this much, but it's a percentage. It is a percentage of what is charged. A percentage of whatever the numbers are, whatever that rate is, that base, whatever that cap is based on other factors that are in there. And that means the higher the cost, the higher the profit. So it's in the vested interest of insurance companies to allow costs to come up, because that is truly the only way they can increase profits. We haven't even really touched on pharmaceuticals. That is a Wild West show. There is absolutely no regulation, although it's been tried to be contained multiple different times, and there's different bills out there, and there's different executive orders, and different politicians have told us they're going to make this happen. We still all remember the EpiPen, and we still all know that those things can happen at any point in time with any medication that becomes much needed. Even the test, they can't even maintain control over, because you can be charged a test from free to $2,100. And an insurance company that's turning that in, we're getting numbers all the way from $150 that an insurance company is getting reimbursed for it to over $2,100 for the same test. How is that possible? It makes no sense whatsoever. The cartel that I mentioned of is a number of organizations, and they all have a vested interest in keeping things status quo. Your hospitals, because they can make their own pricing. And as I mentioned before, the insurance concerns, all they're worried about is bottom line. So the pricing going up, they're fine with that. And brokers, my own ilk, we are as guilty as anybody else. We want to push these plans because that is how we make our living. Unless you really see the problem, you'll never, ever try to find the answer, simply because it's not your concern. Your concern is just making money. And that is too many brokers. That's the way that they look at it. And pharmacies, it's just truly, it's just greed. It is nothing but greed. There is no stock to it. There's nothing to govern it. The price can be set wherever they feel the price is. There's just absolutely nothing to keep that down unless change were to come in one way or another. A lot of this has to do with, once again, our mindset that health insurance and healthcare complement each other. And truly, they're meant to do that. But that's not what has happened. What has happened in this country is we have this concept that we cannot have one without the other. And if your belief is you cannot have good quality health care without good quality health insurance, then you'll be happy to pay those premiums and get your discount. The bottom line is there'll be no change in this industry until finally there is a revolt from the bottom. And that is really not even you and I, not even the consumer. The revolt from the bottom is going to come from the employers, because the employers are the ones that are fitting the bill. And until they see the light, and that is the broker's responsibility, until they shed the light and the employers see the light, there's not going to be a change. That is just the bottom line at this point.